Good morning and thank you for joining us. My name is Tina T-Bone. I will be your moderator for today's press briefing. Joining us today, the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. Today we're reporting one case of COVID-19. This case is in the Eastern Zone and related to out-of-province travel. As of today, Nova Scotia has 21 active cases and no one in hospital. Our labs completed 1,756 tests on March 22nd. Here's how the week looks on the vaccine front. All 10 community clinics are up and running, with Amherst, Bridgewater, and Dartmouth locations all delivering their first vaccines this week. There are still appointments at most community clinics, so if you are over the age of 80 and haven't booked your appointment yet, please do so. Booking opened today for all those 80 and older at 15 pharmacies across the province. 25 AstraZeneca clinics are running this week and are all booked with the exception of one in in Inverness. My apologies. 31 long-term care homes are running this week. And today we will get our biggest Pfizer shipment that we've ever received, with 30,000 doses coming in. More than 66,000 Nova Scotians have been vaccinated as of end of day yesterday, and over 20,000 of them have also received their second dose. And yesterday we surpassed our daily record again with 3,800 doses of vaccines going in arms. As we receive more supply of vaccine, we'll be scaling up this rollout. We'll be ramping up through April with the goal of having 200 pharmacies distributing the vaccine by the end of that month. As you know, our government is making an effort to see that the most vulnerable among us are protected from COVID-19. We know that residents of shelters are more at risk given that they are living in congregate settings. That's why in early April, clinics will begin vaccinating those in shelters, a process we expect to be concluded by the end of April. I am pleased with the progress we're making in Nova Scotia. Like you, I wish I could snap my fingers and have everyone vaccinated already. But a program of this size and complexity requires some build time, and that's why Dr. Strang and his team have done that. We've built the infrastructure that we need to vaccinate almost 1 million people. Now that our vaccine supply is ramping up, we will be able to start moving through the age groups quickly over the next few months. Our growth has been steady. We've been consistently delivering more vaccine to Nova Scotians every single week since mid-February. Last week, we had our biggest week with 11,470 vaccines administered, and we expect more this week. By mid-May, we will be able to vaccinate 86,000 people per week. By the end of April, staff and residents of all licensed long-term care homes and all healthcare workers will have received 2 doses of the vaccine. We are making progress, and our plan is on track. And contingent on expected supply from the federal government, by the end of June, all Nova Scotians who want the vaccine will be able to get one. Then we'll be relying on everyone to get their second dose of vaccine so we can develop our population immunity. Thank you, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Almost good afternoon, everybody. As you know, right before, or a little bit earlier this morning, right before this briefing, we delivered a technical briefing. Tracy Barbrick, who's the ADM lead on our vaccine program, and myself. And our goal was to give an update on where we are with our vaccine rollout. I want to touch bases on some of the highlights of that. I am very confident in the plan that we have in place. And I'm confident that Nova Scotians who want vaccine will be able to get their first dose close to their home by the end of June. And I'm confident that given our epidemiology, following an age-based approach and delivering vaccine to older Nova Scotians first is the right thing to do. Through sport, education, and my career, I've learned the importance of setting a goal, establishing targets, carefully planning to build a strong foundation, and staying focused and trusting your plan when it comes time to execute. And this is the exact approach we are taking for our vaccine program. Our overall goal is to build a high level of population immunity against COVID-19 as fast as possible. And a key target for is to have every Nova Scotian the opportunity to get their first dose of vaccine by the end of June. and then for everybody to get a second dose about 4 months later. And our plan is based on getting good at rolling out vaccine and then getting fast as our vaccine supply increases. We are building a strong foundation so that we're ready to go when we start receiving those larger amounts of vaccine. And I would like Nova Scotians to also have the confidence in our vaccine plan. On that note, I think it's important for me to address two criticisms that we're hearing. The first is our rationale for not vaccinating people with underlying health conditions sooner. I understand why there are questions about this, and I understand people are concerned. However, we need to look at what is the best approach for all Nova Scotians as we plan and implement our vaccine program. Our epidemiology right now is very good. Thanks to our collective efforts, Nova Scotia is a very safe place to be, and the risk of anybody contracting COVID-19 is low. In addition to that, we've been practicing public health measures that have protected all of us, including people with underlying health conditions, from COVID-19 for the past year. Washing our hands, wearing masks, maintaining distance, isolating after travel, regular testing, staying home when sick. These are the things that will continue to protect all of us while we wait for a vaccine. And as we vaccinate people by age, we are rapidly building a wall of immunity around people with health conditions until they themselves can get the vaccine. Focusing on age is the best way to meet our goal of building a high level of population immunity against COVID-19 as fast as possible. This is how every adult in Nova Scotia will have their first dose within the next 3 months. The second thing I want to talk about is the comparisons of Nova Scotia's plan and progress to other Canadian jurisdictions. We decided early on to hold back the second dose of vaccine to be sure that if supply changed, we could give people the second dose in the 21 to 28 day window that is recommended by the manufacturer and was the advice from the National Advisory Committee on Immunization at the time. While few other provinces made this decision, it has served us well when our supply was reduced on 2 occasions. Both times, Nova Scotians got their second doses when they were due, when other provinces were not able to meet that commitment. When the recommended time between doses changed to 16 weeks, we feel it's important that we honor the second dose commitments that were already made to those who had received their first dose prior to this change. By April 2nd, those commitments to 21 or 28 days will be met, and we will be no longer holding back vaccine for second doses. Every dose we receive in the province, starting this week actually, will be delivered as a first dose. We have enough on reserve for the second dose holdback until April the 2nd. And then, of course, once we get everybody first dose, I have to keep saying that we're not through, then we have to focus on second dose through this summer and fall. Through this first phase of the program, we've also focused a lot of time and energy up front on building the necessary infrastructure to support the delivery of this vaccine. We built a central booking site for Nova Scotia, an online tool that allows all Nova Scotians to go to one place to find out where and when vaccine is available and to make a choice that works for them. Some provinces do not even have the online tool capacity developed in their province. We've run a series of prototypes with community clinics, pharmacy clinics, physician clinics, and we're going to test our mobile vans with the homeless population in early April. The goal of these prototypes continues to be to learn, improve, and be ready to scale up these clinics when our supply starts to increase. We've trained hundreds of people to be able to immunize and get vaccine into arms, and we've recruited hundreds of volunteers to support the clinics in various roles. We have built a solid foundation to support the rollout of hundreds of thousands of doses of vaccine in the coming weeks. We've gotten good, and now we're going to get fast. And because of that, the national picture is starting to shift. Nova Scotia's growth in terms of doses in arms is steady and significant. By the beginning of May, we will be able to deliver about 86,000 doses of vaccine per week. And I fully expect that we will be cycling through our 5-year blocks of age groups on a weekly basis for the next few months. And I have strong confidence in the planning and preparation that has been done to roll out one of the largest, most complex healthcare programs this province has ever seen. Premier. Oh, I'm not done, sorry. One more of you. And so I'd like to thank, I deeply appreciate that Nova Scotians have put their trust in me through all the ups and downs of the pandemic to date. The approach that we've taken has been based on what's good for Nova Scotia, and so far we have fared well. We have gotten there together, and I'm asking for your continued trust and confidence as we roll out our vaccine program. I guess it goes to Tina.
Thanks, Dr. Strang. Again, a reminder, we'll take one question, one follow-up from reporters in the room and then on the phone in the allotted time that we have for today's briefing. We'll start with Alicia Drouse from Global.
Thank you. Dr. Strang, you have said that the AstraZeneca vaccine will be on a voluntary basis. People will get to choose that versus the mRNA vaccines. I'm just wondering, as we move down to those age groups, like under 65, if there will be anything done to incentivize people choosing AstraZeneca, just so we don't waste any supply that we do get. For instance, if we're in the 50 age group and no one in the 50 age group wants AstraZeneca, will you offer it up to younger age groups at that time?
So right now, all we know is we have 13,000 doses of AstraZeneca. That's all that's guaranteed to us, and that's almost all. The appointments for that are pretty well booked up. We have no certainty yet of, we expect to get more, but we have no certainty yet on the amount and the time of delivery. As we get additional vaccines into our program, whether it's more AstraZeneca or if some point in the future we get Johnson & Johnson or other vaccines that are still in the process of being approved, we will add those in as makes most sense in our overall vaccine program. But until we actually get confirmation of timing and exact amounts, it's hard to figure out exactly what would be the best way to use those vaccines, because the situation we're in now will look very different in a month from now or 2 months from now.
And just in terms of the booking system, I know that there was obviously some issues early on, and that partly to address that for the 80 plus age group, you divided that age group by birthdays. As we get more and more people being eligible, will that continue for age groups? Will age groups be divided up on birthdays, or will the system be able to accommodate everyone at once?
We're looking at, we're looking at continuing that month of birth approach. We're also planning, as we get much more vaccine, we're working, and it should have by middle of April, another call center stood up, which will greatly increase our ability to book appointments as we get larger. It's middle of April when we start to get substantially larger amounts of vaccine. So we'll continue to adjust that registration process to make sure we are taking in groups of people who are the eligible groups, so we don't overwhelm that system, but we're also building capacity as well.
Next, we'll go to Lindsay Armstrong from All Nova Scotia.
Thank you. Dr. Strang, based on your assertion that Nova Scotia will have reached population immunity by about mid-May with 70% of the population vaccinated, I'm wondering what residents can expect to look different around that time. Will things in May look largely the same as they have for the past year? Will people be able to gather in larger settings? What will that look like?
So we're still really at the starting point of having these kind of conversations around what the public health measures look like, whether it's for individuals or for populations once you have high levels of vaccine. We're having those discussions at a national level. One of the pieces, and you've heard me say this before, is that we still don't have the definitive evidence that if I'm vaccinated, we don't know for sure that I can't be an asymptomatic transmitter. That's really critical. The evidence that's evolving looks good, but we need to have some more definitive evidence. Because until we get that proof, it's very difficult to justify why we would relax the requirements for people who are vaccinated when we know that they still could be an asymptomatic transmitter out in the community. So this is an evolving piece that, the evolving science around asymptomatic transmission, As we build higher levels of population immunity, then the risk of having a big outbreak decreases. It also depends on where other provinces outside of Atlantic Canada may be as we get into May and June. Some of the other provinces are actually having upward trends in their cases right now, and the concerns around variants. So there's a lot of factors at play. It's premature for us to start lifting restrictions for people even if they're immunized. We hope to get there. But we ask for, we have to get clarity on science, and we're not going to, create substantive levels of risks as we do this.
Go ahead with your follow-up, Lindsay.
Thank you. And this is a question for the Premier. Understanding that our case numbers across Atlantic Canada are looking fairly steady, I'm wondering when before April 19th you expect that Atlantic bubble, and if there's a scheduled discussion with the Atlantic leaders about when that could happen.
No scheduled discussion. I'll continue to reach out to them when I think that we're wanting to look at an earlier date. Obviously, we're comfortable with New Brunswick coming in as they're aligned with PEI. So that's where we're at today. But I'll certainly, if they have the desire to start talk about before April 19th, I'll definitely have that conversation. And as long as our public health team are comfortable, then we'll entertain that desire.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I know our case numbers are low right now, but are you still concerned about the variants, and would that have any potential impact on the vaccine delivery model?
So, yeah, I'm very concerned about the variants. I mean, as I said, I've seen just in the last day or so increasing case numbers in Alberta, increasing case numbers in British Columbia. Their chief medical officers are speaking, very concerned about variants. We have parts of Ontario. I was on a call with my chief MOH colleagues on Sunday with the United Kingdom. They are seeing substantive increases in the percentage of their cases that are variants, and they're very concerned about what that may do in terms of creating a third wave. So while we're in a safe space here in Nova Scotia and remaining stable in Atlantic Canada, I think we need to be very cognizant of maintaining strong border measures for people coming outside of Atlantic Canada over the next few months while we see what happens with the variant and as it gives us time to build that level of population immunity. Again, the variant is another piece that makes me very focused on building population immunity as quickly as possible, because that is another very important layer of protection we need to add in as quickly as we can.
Go ahead, Natasha.
Okay, and are we still in the second wave? Like, do you expect to see a third wave in Nova Scotia, or does that depend on what happens?
Depends on what happens. I'm hoping we're working really hard on testing, on vaccination, on our border measures to prevent that if at all possible.
Next, we'll go to Preston Mulligan from CBC.
Yeah, Dr. Strang, in the technical briefing, you talked about some of the reluctance and the polling that you did on vaccinations, and it sounds like 1/3 of Nova Scotians who are eligible for the vaccine don't want to get it. So given your concern about the variants and the speed of the variants and that reluctance, what should we take from that, and how effective 70% vaccine cast would be?
I think our polling is 70 to 80%. I mean, I think our target is a minimum of 70%. We will be rolling out, as we get more vaccine supply, we're going to be rolling out a robust communication strategy, talking to Nova Scotians, making sure they have good, accurate information. A key piece of breaking down vaccine hesitancy and is making sure that vaccine is very accessible to people. And so we're focusing in our program, accessibility is a key piece, whether it's accessibility for some of our vulnerable communities, like our First Nations communities, African Nova Scotian communities, homeless. We're very aware that while we're focusing on large numbers of people now, there are groups of people that with whether it's disabilities or people that are homebound, that we need to make sure that we're include them in and toward the end of our strategy. So we're doing things around community transportation, looking at bringing in vaccine into community workshops for adults with disability, and ultimately having kind of a home care model where vaccines brought to people. So we're looking at how we address accessibility along with information over the next 2 to 3 months to do everything we can to. I'd love the modeling we talked about at the technical briefing was based on 90% uptake, which is very optimistic. But I'd love us to be there in that position. And we know that we have the program that we can meet that need for 90% of Nova Scotians by middle to late June.
So the 90% uptake is what gives you confidence in the aging and the age groups being vaccinated by a certain date. That's based on 90%.
Without the modeling that said we can move through age groups and be at, for all adults by middle of June, was based on 90% uptake. And I'd love to be pushed that and go above that. But and if the uptake isn't quite as much, then actually we get through age groups sooner. But we're very cognizant of 70% is kind of what I would say is the minimum we need to meet. And I think it's, our polling, depends which polls, it's 70 to 80%. So I think the majority of Nova Scotians are looking very positively towards getting vaccinated, and certainly the demand for our clinics is there.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
Dr. Strang, I repeat the numbers of nobody being hospitalized like today. And when I do that, I've often been contacted by people that say, hey, I know someone that went into hospital with COVID, and they're still there. I think that they must be testing negative, and so they're not considered in hospital with the disease. But that zero number kind of misses something, and I just wonder if you could speak to that.
So if people are diagnosis, two things. So once they're at least 10 days past their infection, the start of their symptoms, and their acute symptoms have resolved, they're no longer considered, we say that their case of COVID is resolved. Now, for some people, we've had, they've been in hospital for quite a period of time, because if you're very ill and you're in the ICU, there's all sorts of reasons you get secondary complications, et cetera, from your initial infection that may keep you in hospital. It depends on ultimately the clinicians. Is the reason that they're still in hospital directly related to their COVID infection, or is there something else that's happened because of that? But we rely on this data from our clinicians in the hospitals, and right now we're telling us we have nobody in hospital that is there directly because of a COVID infection.
On the vaccination, at a previous technical briefing, not today's, but we were told that people who get vaccinated will get some sort of documentation, whatever. I know that Israel actually has an app that you can see if you've been vaccinated and whatnot. What does that look like here?
So we have an app, Can Immunize. So we encourage everybody to use it for when it's been there for several years for your routine childhood immunizations or your adult immunizations. We would encourage everybody to get the download the Can Immunize app, because if you have that on your phone, when you go in to get your COVID vaccine, you'll get that information uploaded right onto your phone, and there's your record. But we also have capacity at the Halifax Forum that we have, all the clinics will be this way. Printers. So if people need a paper copy, they don't have a phone or whatever, they can get a paper copy. So people will get a record of their vaccination one way or another. Electronically as our preference, but people will get a paper copy if they need it.
We'll go to the phone lines now for questions. The first question will be from Danielle Edwards with the Canadian Press. Go ahead, Danielle.
Hi. This question, I think, is directed at Dr. Strang, but I wanted to ask what happens if all of the AstraZeneca vaccines aren't used by the expiration date of April 2nd? If we get a little bit closer to that date and it still seems that there's quite a bit left back, is there a plan for just distributing it more widely so it gets used before it expires?
Yeah, we'll continue to look at that, but everything we have right now is that there's the vast majority of that vaccine is already appointments made for. So we'll continue to push that over the next week and make sure we use as much of that vaccine as we can feasibly do. But at this point, I'm not anticipating any significant amount left over because of the booking of clinics.
Go ahead, Danielle, with your follow-up.
Yes, and I wanted to ask Premier Rankin, because of the announcement that there's going to be money funneled to Boat Harbor for the dredging. And I wanted to ask if the public will be repaid for the cost of having to clean the area.
So, as you know, we're in court, and we'll have to ensure that we meet our obligations. The Boat Harbor facility is on government land, but right now we need to make sure that cleanup, that very important cleanup of Boat Harbor, stays on track. And the minister order for the company to start their end of the cleanup process has not been followed. We need to make sure that stays on track, that the timelines stay on track. Having one company go in and actually manage the full cleanup was also a consideration for us. And we would not be able to meet timelines because the company did not bring forward a plan to decommission and start that work. And so that's the main focus, to ensure that when we have the permit from the federal government, that cleanup can start, that it's efficient, and that it gets done.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, we were told at the technical briefing that pharmacies and doctors' offices will be delivering most of the shots by mid-May. I believe is in the 75% range of the shots that will be going out will be delivered at those sites by mid-May. We're hearing now from older people in places like rural Cape Breton who are having trouble getting to a clinic. Will that problem be addressed by the clinic expansion expected over the coming months?
Yeah, just say it was, 2/3 of our vaccine is expected to be through this network of growing number. I think it's over 200 pharmacies ultimately and about 50 physician clinics, along with our existing 10 community clinics. That will, we haven't fully, that will grow, that network of clinics will grow as our vaccine supply grows, and that should address most of the problems. There are some places in the province, a few places such as the northern part of Cape Breton Island, where we're working actively on some very specific solutions. So no part of the province will be kind of left behind in terms of geographic access. There's a couple of places that need some very specific solutions that we're working on.
Go ahead, John, with your follow-up.
Thanks. This is again for Dr. Strang. I've heard people talking about looking forward to a more quote-unquote normal summer, given the vaccination program plans and the low COVID activity. And after conducting the symphony this weekend, you yourself expressed hope that we'd be able to enjoy more things like musical performances. What's your level of optimism right now for the summer? What are things going to look like?
Yeah, I'm cautiously optimistic that we'll be able to do more things, especially outdoor activities, which are always much safer than indoors. I think we have to, as I gave an answer to a previous question, there's a number of things. Our vaccine uptake, what we learn about are people protected against from being asymptomatic transmitters if they are vaccinated. A lot depends on what's happening with the variant strains in other parts of the country and globally, and what is the kind of risk for whether it's a Nova Scotia, a maritime, or an Atlantic bubble that we're able to create. So I think I'm cautiously optimistic, but I know that we're going to have to we're going to have to focus on two things. The summer and fall are going to be people who have first dose need to get second dose, and if there are people who for some reason haven't got their first dose, we'll still immunize them in the summer and fall as well. But I also think we're going to have to live with some type of personal and family COVID protocols, as well as collectively having things whatever the necessary levels of quarantine, etc., on people entering the province from other parts of the country, perhaps, or other parts of the world. So we're not out of the woods by all means. I think I need to. While I'm cautiously optimistic, we're going to be having to living with COVID for a number of months, and then probably longer term, COVID is going to be with us for the long term. And we don't really know what the future is at in terms of whether we're going to need a booster dose, or maybe we have kind of like a flu vaccine approach, and what type of COVID protocols we all have to live with, especially in the winter months.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. Dr. Strang, we're seeing a lot of reports online, and I mean, those have been going around for a few weeks, just around AstraZeneca and issues in Europe, and now in the States there's some different things going on with misreporting of the accuracy of the data. It's a little confusing even for me, but I'm wondering how we are supposed to balance, information from people who are anti-vaxxers versus people who are recommending to get the vaccine. How are people supposed to know what's real, what they should be believing that's out there online?
So, first of all, I'm not sure there's a balance. I wouldn't say it's a balance. People who have specific anti-vax sentiment do not bring forward accurate scientific-based information. So the first thing I would encourage people is get your information from a credible, accurate source, whether it's the information we have on our coronavirus website, the Public Health Agency of Canada, CDC Atlanta. Listen to groups that, the people who are producing recommendations now from Europe and the UK around AstraZeneca, the World Health Organization. There clearly is a consensus opinion that while there is these very rare complication of blood clotting events, that the benefits of AstraZeneca vaccine far outweigh any potential risks. So all credible medical regulatory bodies are on the same position on the safety and ongoing use of AstraZeneca vaccine. But in general around COVID vaccines, rely on good, credible information. And we have information and links to other sites on our coronavirus website.
Next, we'll go to Pat Healy with the Laker. Go ahead, Pat.
Hello, Dr. Strang. This question is for you. We're getting into the 11th hour for planning of proms and graduations. Parents and school administrators who organize these events are getting frustrated because they have no direction on if they can hold them. So what's the holdup from public health in letting them know what can or can't happen? Are there any discussions ongoing?
So thanks for the question, Pat. I've had a conversation in the last couple of weeks with my colleagues in the Department of Education. Their focus is going to be on graduation, honoring people's educational achievement, and doing that in a way that they know they have to plan. I can't give you any certainty about where we're going to be in terms of gathering limits and all the other COVID protocols when it comes to late May and June for graduation. But the education system is doing contingency planning, and they're going to focus on graduation. For proms, their position is, and I support this, is that they're really going to leave that to families and communities. That they're going to, if they want to have some way of more of a prom that just celebrates these young people. But again, that's going to have to be done in a way that follows the gathering limits and other COVID protocols. And I cannot tell you with any certainty where we're going to be with those in May and June. I get the frustration. But there's lots of other groups that would love to be able to plan, and we just, it's the reality of being in a pandemic. Medium to long-term certainty is not something that we can provide.
Go ahead, Pat, if you have a follow-up.
Yes, I do. What has to happen to allow spectators back into sporting events at high schools?
So the reason we're allowing spectators at sporting events in general, but the education system has, and I support this decision, said that they're being very careful about who comes into their buildings for after hours for non-directly educational purposes. They're really focusing on protecting their buildings and the space within those buildings. So we've done a really good job of keeping our schools safe, but we need to have our primary focus on education. So at this point in time, they're saying that bringing spectators, because if you bring in spectators, then you open the door to other people coming in after hours for a range of other reasons, and they're focusing on keeping our schools safe for educational purposes.
We have time for a few more questions. We'll come back to the room. Alicia Drost, do you have one more question?
I do. I'm just wondering if you can confirm, there's just a little confusion this morning with the technical briefing. When people book their first vaccination, will they automatically be booked for a second dose 15 to 16 weeks out, or will they have to go back and...
They get both appointments booked at the same time.
Lindsay Armstrong, do you have one more question?
I'm wondering for the staffing levels at vaccine clinics, we heard that for, say, a clinic with about 12 vaccine setups, they'd have about 50 staff. Can you sort of explain how many of these people are volunteers who've come forward and are paid staff through the Nova Scotia Health Authority?
Yeah, I think some of that will depend on the type of clinic. I don't have the exact breakdown because we have volunteers both who are the direct immunizers, retired doctors, nurses, and then we have volunteers who are doing the other, I guess, supporting functions. So I don't have a breakdown. It would vary from clinic to clinic.
Natasha, do you have another question?
Yeah, I asked you this during the technical briefing, but just so we have it on camera, where are we at in terms of delivering vaccine to long-term care homes in the province?
So I think by the end of March, we'll have all but 2 long-term care facilities with the first dose of vaccine for all staff and residents, and then many of them are already into their second dose. And then through April, we're finishing up. We'll be doing the second dose for our long-term care facilities. We're sticking with that 21 to 28 day piece because that's the premise on which we started, and especially bringing these most vulnerable people, getting them their full immunity as quickly as possible. In April, there's a whole range of that's for licensed long-term care facilities. There's also a whole range of other non-licensed various types of facilities that seniors, residential, independent living to some type of assisted living, but they're not yet licensed as a long-term care facility. We are working with them, and we'll be doing immunization in all those types of seniors congregate living facilities through April as well.
Go ahead, Preston.
Yeah, my question is about the asymptomatic transmission after vaccination, and you're waiting for more data on that. Why don't we have data already on that, given the widespread vaccination, say, in Israel? Who is the definitive word on that, and why don't we know already?
So there's studies going on in Israel and other places. We're looking for kind of expert groups that have pulled together not just one study, but all the studies, and part of this is built into some of the clinical trials, which are ongoing. So we expect to get in the next probably 2 to 3 months some more answers, and the colleagues that I've talked to, they have more expertise in this kind of very specific research area, would say all the evidence so far is looking good, especially for the mRNA vaccines, but we don't yet have the definitive answer yet, but we expect to get that fairly soon. It's like anything, this is evolving science, and we need to get a cumulative body of evidence that would say that's enough, that give us a robust, trusted answer.
Go ahead, Tim.
Lately, there's been a few hiccups on the reporting dashboard. Vaccine information wasn't provided at all yesterday. Is there a problem there, and can we start getting vaccination numbers over the weekend as well?
I'll have to take those back. I don't have a good answer for you. I don't know what the technical issues that were there, and I'm not sure about the answer on the weekend. I'll just take that back and look at that. I know we're trying to update data in a very timely manner.
That's all the time we have for questions. Go ahead, Premier.
Thanks to all Nova Scotians through your efforts, through your commitment to the health of your loved ones and your communities are helping to keep our province safe. Our government is doing the work to see that Nova Scotians receive their vaccinations, to see that Nova Scotians are protected from COVID-19. We are building the public health infrastructure that can manage this complex operation. And in working with public health experts and following the science, we are ensuring that our vaccination rollout does not just work with speed, but efficiency. We are working to deliver the vaccine to Nova Scotians in the most effective manner possible. A large part of this is working with communities and with existing infrastructure. And as we ramp up this careful plan, we have confidence that all Nova Scotians who want a vaccine will have access by the end of June. But we cannot be complacent. While Nova Scotia remains a leader in low case counts and low risk of contracting COVID-19, the situation can change quickly. We ask Nova Scotians to continue to follow the public health protocols that have served us so well up to this point. Practice good hand washing, maintain a physical distance, wear a mask, and get vaccinated when you're able to. Thanks to the diligence and the community spirit of Nova Scotians, we're going to get through this pandemic together. Thank you.